Muted.
All right, welcome everyone to Kaleo's open enrollment presentation for your benefits for 2017. We are going to review a lot of information today. First up, we have your medical benefits that we'll be speaking about. We'll review dental, short-term disability, and long-term disability, as well as your employer-paid life and AD&D insurance. You'll also hear some information about two benefits that you're able to purchase as employees, your buy-up life insurance and the voluntary vision plan that's new this year. We're also going to review your open enrollment process and what you need to do to enroll this year. So open enrollment happens every year around this time. This is your opportunity to elect or decline coverage. You cannot elect or drop your coverage mid-year without a qualifying event. And that's typically going to be a marriage, divorce. It could be the birth or adoption of a child. It could also be your spouse's open enrollment. Those are all reasons that you can go onto the online system to process that qualifying event and let HR know. You do only have 30 days when you have one of those qualifying events that happens to notify HR that you do need to make that change. Outside of those reasons, you're really locked into your decision for the whole year because of the pre-tax advantage that's put in place by the IRS. And then, of course, every year at open enrollment, you're able to make changes to the plans that you're enrolled in as well as who you're covering each year. So let's dive into your benefits. We do have a new health insurance carrier, Cigna, and just a few highlights from Cigna. You will have access to a broad nationwide network of healthcare professionals and facilities. It is called the Open Access Plus Network. You'll see that at the top. That's important to note when you are searching for providers. If you go onto the Cigna website, it is called, again, the Open Access Plus Network. You're always recommended to select a primary care physician because it's great to have that relationship to help guide your care. However, it's not required that you list a primary care physician. You don't need referrals to go see a specialist. And, of course, you're always going to pay less when you stay in-network. You do have access to out-of-network providers with the plan that's offered to you all. However, they can balance bill you. We'll talk a little bit about that. But when you go in-network, you're going to pay less because your benefits are set up that way, and Cigna has contracted with those network providers for bigger discounts. Cigna and really a lot of the insurance carriers that are out there do promote preventive care services to keep you healthy. Your plan provides, just like it has in the past, 100% coverage for preventive care services. Those things are available, or the whole list of guidelines are available on the website. However, I will let you know there are a few things that are easy to remember. Your annual physical each year, child checkup visits, whether they're a baby or whether they go once a year, once they're in school or something like that. You'll have coverage for any immunizations and vaccinations that are required based on their age. You'll also get coverage for certain preventive care screenings, so things like mammograms or colonoscopies, as well as PSA tests for men. Those are all things that are covered, and again, it is based on your gender as well as your age as to what's recommended and what's covered at 100%. Since we are making the transition to Cigna, you'll see some tips listed here for an easier transition. It's always recommended that you inform your doctors and pharmacies of your new Cigna insurance medical plan. Make sure that you do talk to your doctor about any medications that you're taking and any prior authorizations that may be on the medications as well as step therapy, so that that will be easy to transfer or refill come January. We always recommend that folks refill medications in December if you're able to, so that you don't have to worry on January 1st or 2nd that you have to go pick up a medication that you might need. We also encourage you to check out Cigna's Pharmacy Home Delivery. If you are using Aetna's at-home mail delivery program for any maintenance medications, those will cease as of January 1, but you can sign up for Cigna's, and they should be fairly similar. There could be some differences. Now let's talk a little bit about the benefits that are offered to you. Remember, all of your benefits are paid for by Kaleo, so that means that they will be paying for 100%, whether you're employee only or up to family. They pay for the cost of your services for the benefits that are offered to you. You'll see the chart that's listed that is a high-level overview of the benefits that are offered through Cigna this year. Your deductible is still $2,000 for an individual or $4,000 if you have family coverage. Remember, there is an HRA, or a health reimbursement account, that helps pay for part of that deductible. We'll talk more about the HRA in just a moment because you do have some extra coverage there. But the actual deductible provided by Cigna, again, is $2,000 for the individual or $4,000 if you have family coverage. What's great this year is if you do go to the doctor's office for services, the primary care physician copay, or PCP copay, is lower this year. It's $20. And then if you need to go see a specialist, the cost for that visit is $55. Those visits, you do not have to pay towards the deductible before it's covered at that copay, so it's just an automatic copay whenever you use those services. You'll also hear some more information in a moment about the Cigna telehealth services. That's where you're able to talk to a provider either online or on the phone. The copay for that is $20. And then an urgent care provider copay is $75. That is for urgent care services, so things that you may avoid going to the emergency room for, but you're able to go maybe over the weekend. It could be a sprained ankle, stitches, something like that. I will say that there are some convenience care providers, places like the Minute Clinic, the Little Clinic through Rite Aid, and there are some other ones where if you are utilizing their services for primary care physician needs, you can actually get a copay of $20 for those services. What you'll see next in the chart that's shown here are really services that can be attached to the hospital, so emergency room visits, an inpatient stay, so that's an overnight stay at the hospital, outpatient services or surgeries, that's when you're in and out of the hospital the same day, as well as any type of diagnostic lab services that are provided. You do have to meet that deductible of $2,000 first for an individual, and then you'll pay a coinsurance of 25% after that deductible has been met. So you do have some additional protection once that deductible has been met, where you're only paying a portion of the services that you might need. And again, we're going to talk about how the HRA works to help reduce your costs as well. The most that you're going to pay out of pocket, you'll see back up at the top, it says maximum out of pocket. That is $6,850 for an individual, or $13,700 if you have family coverage. That's your worst case scenario. That's if you did utilize a lot of services over the course of the year. That's the most that you would have to pay out of pocket. Your copays at the pharmacy are $15 for Tier 1, $45 for Tier 2, and then $100 for Tier 3. Tier 1 medications are typically going to be your generic drugs. Tier 2 are the brand name drugs, and Tier 3 are the non-preferred brand name drugs that are available in the marketplace. You will save half a copay for a mail order. That's where you're able to fill any maintenance medications. You can get up to a 90-day supply mailed to your home, so you do get the convenience, and you save half of a copay if you utilize those services. So it's $38 for Tier 1, $113 for Tier 2, and then $250 for Tier 3. Again, it's really nice to utilize that if you do take any drugs on a regular basis. So, for example, it could be something like high blood pressure medication, high cholesterol medication. really anything that you're taking on a daily basis. You cannot utilize mail order for something like pain medication or something that's short-term like an antibiotic. You'll see listed at the very bottom that you do have some out-of-network benefits. We really encourage you to stay in network as much as possible, but we do like to remind you that you have out-of-network coverage if you need it. All of your covered services are, if you utilize those out-of-network services, you'll have to meet a separate deductible of $5,000 and then pay 50% of the charges after you've met that deductible. And then for family coverage, it's $10,000. You'll see some notes off to the side talking about how benefits work between an individual or a family. One person in the family will never pay more than that individual deductible amount, so that's a nice benefit. Preventive care services, again, are covered at 100%. We mentioned what some of those are. And then just remember that some medications do require pre-authorization or step therapy. There will be some information posted on the Simplify Prime site so that you can review that prior to January 1st. A few pharmacy reminders. You'll be able to find a complete list of covered medications on mycigna.com, and you can compare the prices. And then just a note on mail order, you are able to still utilize mail order, but you would need a new prescription to get those filled through mail order. You don't pay anything for shipping for that, and then they do provide some extra supplies, things like syringes or needles, depending on the medications that you're taking. And then you can also call that number, 1-800-285-4812. You would not want to call that number for mail order until January 1st, though, when your benefits are effective. I'm going to check real quick to see if we have any questions that are relevant to what I've just talked about. One question that we had is, will the presentation be available after the webinar? And the answer to that is yes. We are recording this, and we will make it available to everyone. Okay, let's keep going through the information. There is a nice benefit that's included thanks to healthcare reform. There are some no-cost preventive care medications. You do need a prescription from your doctor in order to take advantage of some of these. So, for example, if you have a heart condition and your doctor has recommended that you take 1 aspirin per day, for example, if he writes you a prescription for that, you can actually fill it through the pharmacy at no cost to you. It's part of the Affordable Care Act for coverage. And then you'll see a list of other things that are listed here. Again, you do have to have a prescription from your doctor to take advantage of these medications at no charge to you. The medical plan that's provided by Cigna also includes an exam for vision services. That exam is truly for determining your prescription that you may need for glasses or contacts. It is a $15 copay if you go in network to a Cigna provider, and you're able to do that once per year. You heard me mention earlier that there is a voluntary vision program that's available this year. I'll talk more about that in a moment. But all the plan that's offered to you, this $15 copay for the eye exam is available to all members that are covered under your health insurance policy. But that is truly all it covers is the exam. There's no additional benefit for things like contacts or glasses. A few reminders on Cigna service. You are able to utilize the customer service line. It is open 24/7, and you'll see the number that's listed there. It will also be on your ID card. You'll also be able to use the internet to access MyCigna benefits at www.mycigna.com. You'll see information on the benefits that are offered to you, any claim information, as well as being able to print a temporary ID card, things like checking out the cost for services or medications. Lots of great information is available out there on that mycigna.com site. And what's really nice is that you can also download an app on your smartphone or tablet so that you can access that information on the go as well. I mentioned earlier about the telehealth services, and this is a really neat benefit that we're seeing more in the health insurance industry that's offered to employees, where you'll actually have access to utilize a medical provider by phone or through your smartphone's more or less the camera service, where you can almost like Skype with a doctor. Cigna actually has two services that you can register for. It's Amwell for Cigna.com or MD Live for Cigna.com. There are two different services. You can register for one or both. We recommend that you do go ahead and go out there and register ahead of time, so that if you are ever ill and need to utilize the services, you don't have to worry about setting up your account and answering a few of the medical questions that they do ask. Telehealth is great for things that you may know that you have easy things to kind of diagnose yourself with, whether it might be a sinus infection, it could be a flu, it could be pink eye, really things that the doctor can either talk to you through the phone or are able to see through your smart device and diagnose you. It's obviously not going to be a good fit for something like an emergency service like stitches or a broken arm or leg, but it is a really nice benefit if you kind of know if you get a sinus infection, for example, once a year. This is a great way for you to avoid having to go sit in an urgent care center or at your primary care doctor. You know, it's a nice quick fix, especially over the weekend. So again, these are apps that you can download and input that information ahead of time if you wanted to utilize that. And it is available to you as just a copay of $20 under the plan, regardless of which service that you use. So now we're going to talk a little bit about the HRA, or Health Reimbursement Account, that's offered. It will be offered through Cigna this year, and you'll be set up with that account, and you can view your activity through the mycigna.com website. Your HRA funds are eligible to be spent only on your deductible amount. You personally have to meet the first $1,000 of the single deductible, or the first $2,000 if you have family coverage. After you've met that first $1,000 or $2,000, then Cigna and Kaleo are going to pick up the rest of that deductible, which is another $1,000 or $2,000. You'll still get an explanation of benefits offered through Cigna that's going to show you what amount of the service that you've had has applied to your deductible, what's been paid to your provider from the HRA, and then what you might still owe based on your coinsurance. You never want to pay any bill from a provider until you've received that explanation of benefits. And again, you will have access to those through the mycigna.com website. New this year, the HRA funds are going to be reimbursed to your provider, and they are paid directly to the provider. So that is different than what you have in place today. If you're a current employee, you will no longer receive a check from the HRA account for those services. And just a reminder that copays and coinsurance are not part of that deductible, so they're not available for reimbursement from the HRA. And if you're enrolled in the family plan, the HRA is not going to begin reimbursement until that family portion of the deductible has been met, either through one person or a combination of folks under the plan. And then this just shows a different way of looking at it visually as to how that deductible works. You, the individual, if you have individual coverage, are going to pay the first $1,000 towards your deductible costs. And then Kaleo and the Cigna HRA are going to pay the next $1,000. And then your deductible will then be covered after that $2,000 has been met, and then you'll just be paying that 25% coinsurance or copays for the remaining services until you've met that out-of-pocket maximum. Similarly, with the family deductible, the family is going to pay the first $2,000 towards your deductible costs, and Kaleo and the HRA are going to pick up the next $2,000. And then after that, Cigna is going to pay $4,000, or anything over and above that $4,000 deductible. You would be responsible, and your family members, for paying that 25% coinsurance or the copays at the doctor's office until you've met that out-of-pocket maximum. And we wanted to show you an example of what the explanation of benefits look like. You'll see this here. You'll be able to see when that date of service occurred, what parts that were billed and what your plan actually paid, and then really what you owe, as well as how much you saved by having the health insurance. On the bottom or on the back side, you'll also see some information on what you need to know for the next claim that may come in, depending on how many services you've had over the course of the year. So they try to be as detailed as possible to help you understand how your benefits are working. As well, the information on the explanation of benefits should always match up, again, with the bill that you've received from your doctor's office. I'm going to check real quick before we talk about the dental insurance to see if we have any questions, and I see a few here. Let's see. We have the Minute. Someone asked if the Minute Clinic copay is $20, and yes, for those convenience care services, it would be $20. The cost for the Cigna telehealth services, again, it's a $20 copay when you're using those services. Can telehealth doctors prescribe medication? That's actually a great question, and yes, they can provide medications for you. That's one of the nice benefits of utilizing those providers. So if you do have something, for example, like a sinus infection where maybe you're prescribed an antibiotic, they can definitely do that over the phone. All right, and I think that wraps up all the questions that we had about the medical. Great questions, everyone. Thanks so much for being engaged. So now we're going to talk about the dental insurance. This is also going to be offered through Cigna. You'll see that this is an employer-paid benefit, whether it's employee-only or family coverage. Dental insurance works a little bit differently than the medical insurance, and the way that it works is that you'll see here a calendar year maximum, and that calendar year maximum, that's the most that the dental carrier, which this year is Cigna, is going to pay out for services over the course of the year. So the most they're going to pay out is $1,000. That's different than the medical because medical says you pay up to a certain amount, and then they're going to pay the rest. And the reason for that really is typically dental coverage is not as expensive as medical services that you might access. So over the course of the year, you're going to have your preventive care services covered at no charge to you. You do not have to meet the deductible. You get 2 cleanings a year. Typically that's every 6 months, and we would encourage you to, of course, go for that, for those cleanings. If you have to have any type of additional services over the course of the year, you'll see that the deductible would apply. It's $50 for an individual or $150 if you have family coverage. And depending on what you have provided to you as part of those services will depend on the portion that you pay. The basic restorative are typically going to be things like fillings. It could also be a root canal or a tooth extraction. You're going to pay 20% of the cost of that service after you met that $50 deductible. If you have to have major restorative services, that's typically crowns, bridges, dentures, implants as well, you'll see listed. You're going to meet that deductible, and after it's been met, you're going to pay 50% of the cost. You also have coverage for orthodontic benefits, and that benefit is 50% of the cost. There is no deductible for that, and it's a $1,000 lifetime maximum. So that is separate from the $1,000 annual maximum that's applicable to anyone that you cover under the plan, but the orthodontia is just for the lifetime $1,000. And you will see off to the side that you do have coverage for out-of-network services for dentists. Obviously, you're going to get a better bang for your buck if you stay in-network, but if you do choose to use an out-of-network provider, you do have coverage for that. Just like the medical plan, though, they're not contracted providers, and so they can balance bill you for services that go over and above what Cigna has contracted with dental providers that are in their network. So to give you an example, if you went in for a cleaning and the dentist charged $150 and they were not in the network, if Cigna only allowed $100 for that service, then they could just come back to you and balance bill you for the additional $50. And that is not going to apply towards your maximum for those additional costs for services. The name of the network for the Cigna plan that's being offered for the dental insurance is called the DPPO network. You can actually go to mycigna.com and search for providers that are in that DPPO network, or you can call the 1-800 number to talk to someone to help find a provider. You don't need to show your ID card to receive care, and generally they're going to submit those claims on your behalf. Sometimes if you go to an out-of-network provider, they may not do that, so it is something that you may have to download the form from online and just submit on behalf of the provider if they're not in network. And again, you do not need a referral for the dental plans if you do need to see a specialist. So before I wrap up the dental, I'm going to see if we have any questions here. Okay, does orthodontia include adults and children? The answer to that is it only includes children through age 19. Family coverage for medical and dental for children does apply to children through age 26, and that's applicable for the medical plan and the dental plan, as well as the voluntary vision plan we're going to talk about in a moment. You're able to cover children through the end of the month that they turn 26, and that means it's really regardless of whether they live with you, they could have their own job, they can be married even. You can still cover them, again, to the end of the month they turn 26, regardless of student status or any other status, as long as they're your child or stepchild. Have another, is the orthodontics max per person if family coverage is applied or for the entire family? It's actually that $1,000 maximum that you'll see listed here. It's applicable to each person that is covered or each child that is covered for the orthodontic benefit. So you do get $1,000 per child for that. And all right, let's see. Okay, now we're going to talk about the disability plans that are offered to you all. Again, we are moving this to Cigna as well, and you do have the coverage for the disability is paid for by Kaleo. So it's something that you don't have to pay for, but it's a great benefit. You don't always think about how nice it is, but really disability insurance is going to pay for your paycheck. It's almost like paycheck insurance if you're not able to work because of an illness or an injury. And you really are going to hopefully not have to use that benefit, but if you do have the coverage for it. So first up is short-term disability. After you've been out for 7 days, it's going to pay 60% of your weekly earnings up to $2,000 per week. And that benefit's going to pay out for a maximum of 12 weeks if you're not able to go back to work. Now, if you're out for a shorter period of time, it's just going to pay out until you're able to come back. And then if you're out for a longer period of time, it'll pay out up to 12 weeks. And it does coordinate with the long-term disability that we'll talk about in a moment. So really, it's nice. Most people, if they have to use disability insurance, it typically falls under the short-term disability, and it does include maternity coverage as part of this benefit. It does match up with long-term disability, meaning after you've been out, if you continue to go out after that 12 weeks, that's really the same as the 90 days from the date of the disability. Then you're going to move over to long-term disability insurance, and that's going to pay out 60% of your earnings. And instead of a weekly benefit, it's going to change over to a monthly benefit, and it's $13,000 per month. And it's going to pay that out until you're able to come back to work or until you reach Social Security normal retirement age. And so It's a really nice benefit to have paid for as an employee. You don't have to worry about how you're going to pay the bills if you're not able to go back to work, again, because of an illness or injury. It is paid for by kaleo as an employee. Now, there's also life insurance that's paid for. So if something were to happen to you and you were to pass away, you do have life insurance coverage of $50,000. And then you also have $50,000 in coverage if you were to pass away in an accidental death, or there's also a clause that includes dismemberment benefits as well. If you're still working at kaleo, once you reach age 65, that benefit does reduce to 65%. And then if you're still working at age 70, it would reduce to 50%. You do need to designate a beneficiary online, and we encourage you to make sure that's up to date. Really, anytime you may have a life event, you don't have to wait until open enrollment to do that, but it's a good idea as a reminder to do it at open enrollment. So make sure you know who that beneficiary is so that if something were to happen to you, the money goes to the loved one that you've chosen. There's also the ability as an employee to choose voluntary life insurance. And so this is a benefit that you would pay for to get additional term life insurance coverage. You can select as an employee increments of $10,000 up to $500,000 in coverage, or 5 times your salary. So it's the maximum of really 5 times your salary that you can elect. If you have a spouse, you can choose increments of $5,000 up to 100% of whatever amount you've elected, or $250,000. $250,000 is the maximum. And then if you have children, you can choose increments of $1,000 up to $10,000, and that's for any children ages 6 months and older. You'll see a note listed that mentions guarantee issue amount. And so that's the most coverage that you can get as a new enrollee or as a new employee is $110,000 for an employee, and then $25,000 for a spouse, and then the maximum amount for dependents is covered. So for an employer or spouse, you would have to undergo medical underwriting or evidence of insurability if you exceed those amounts. For those of you that are current employees that are enrolled in the voluntary life insurance coverage through UNUM, your coverage is going to continue, and you will not have to complete any evidence of insurability if you're maintaining the amount that you've elected last year or the prior year. If you choose to change the amount that you're enrolling in and you exceed that guarantee issue amount, you do have to undergo evidence of insurability. And typically it's just a couple of medical questions that you'll answer, and Cigna will review that information, and then from time to time they can send out someone to do a paramedical review as well, where they send someone out to speak with you or do some lab work to determine if they will cover you for that coverage. So again, if you did not enroll in the life insurance coverage last year or any prior years and you were employed at that time, then you would have to undergo that evidence of insurability. If you are currently enrolled, you don't have to worry about completing that evidence of insurability again. They call that grandfathering, so you don't have to worry about going through that process again. So we've talked a little bit about anyone that is enrolled in UNUM that's greater than that guarantee issue amount. You are grandfathered in. You will need to continue to make that election online, but you do not need to submit a new medical screening form. And if you want to change whatever you're enrolled in, if you increase your amount that is over the guarantee issue, you will submit that evidence of insurability form. And part of the life and disability programs offered through Cigna, they do provide a program called Life Assistance. And it's really nice. You're able to call in to speak to a specialist and get 3 face-to-face sessions with a behavioral health counselor for any incident that occurs. You'll get that 3 visits for any number of incidents that you may need assistance with or questions on. It can be things like stress levels at home, going through a divorce, stressful time with your parents. Maybe they're going into a nursing home. You could have a child that's going into middle school or high school or college, and you just need someone to talk to. Again, for any incident, it's 3 face-to-face sessions with a behavioral health counselor, and you can access that. Really, it's for you and anyone that lives under your roof. It's available to you at no charge. There's also some great benefits that are available online through the cignabehavioralhealth.com website, where you can get some minimal legal consultation information, additional help on parenting, senior care, child care, pet care, things like that, as well as financial services or referral to someone to speak about your finances. And if you really think about it, going through a disability that we talked about before, where your income is reduced, it is a financial change of status, and so it could be a good idea to reach out for something like that. All of these programs are 100% confidential. Kaleo does not know that you utilize those benefits, so it's another thing that you can take advantage of that's part of your employee benefits program. I'm going to check real quick before we talk about the vision program to see if we have any questions about the life or disability. Okay, so one question is, can you drop voluntary life insurance at any time during the year? And the answer to that is no. You do have to wait until you've had a qualifying event or until you have open enrollment next year. So you do have to wait for one of those events to happen in order to drop any of the coverages that we've talked about today. And one question is the cost the same per month as Unum? And the answer to that is you will see it when you go to enroll online. But yes, it should be the same as what you've had with Unum, or it could have gone down slightly. All right. Now we're going to talk about a new benefit, voluntary vision, and it is offered through IMED. So this is a vision benefit where you're able to elect this coverage. You pay for the cost of this, and you're able to get some additional benefits that aren't really offered through the medical plan. Mostly it's going to benefit you if you wear contacts or glasses, and it can be a great benefit for you or any family members that have to utilize those services. You'll see that there is an exam benefit. It's $10 copay to go use an IMED provider. Their network may be different than Cigna, so I would tell you if you're enrolled in both to check the networks. It's slightly lower than what you would have with the Cigna benefit, so you can use either depending on, you know, really the network that your provider might be in. And then if you have to pick up glasses or contacts, you have some benefits for that. So for your frames, you have a $130 allowance, and then you're going to get 20% off of the balance if they cost more than $130. So most of the eye care providers are going to have a selection that you'll be able to pick from, and they'll let you know what the costs are for those services. And then as part of your frames, obviously you're going to need lenses. So you'll see listed here some different copays, whether it's single vision or if it's aligned bifocal, it's going to be a copay of $25. And then if you wanted progressive lenses, depending on the level, whether they're standard or premium, you would have a copay for those anywhere from $90 up to $135 copay. If you wear contacts, then you're going to have a benefit of a $130 allowance, and then 15% off the balance that's over $130. And if you wear disposable contacts, again, it's a $130 allowance for those contacts. You'll see listed medically necessary, where you don't have to pay anything. It's pretty rare for anyone to fall into that medically necessary category. It's going to be something generally for a medical condition of the eye, not just to correct your vision because your vision is bad. It may seem like a medical condition, but it is not considered that in this scenario. You'll also see some additional discounts that are available to you. You'll see some discounted lens options, whether you do a tent or UV treatment, if you want scratch coating, things like that, you'll get a discount for those services as well. And then really any other add-on services, you're going to get a 20% discount as well. And then for contact lens wearers, if you're aware of those lens fitting fees, you will pay up to $55, no more than that, for those services. And it really just depends on how your eye doctor charges for that. And then some folks had asked about the cost for this. So per pay cost, you'll see listed is anywhere from $3.58 for employee only, and then family coverage is $10.51. Again, this is listed out per pay. All right, I am going to check and see if we have any questions on the vision. Okay, I don't see any questions on the vision. So now we are going to talk about enrolling online through the Simplify Prime website. So all employees must go online to complete the enrollment. You'll go to the My Simplify login to be able to enter your username and password. You will be receiving an email from Mary Canada to give you some login instructions. If you haven't enrolled before, you'll create your own account. If you have enrolled in the past, you'll just need to remember your username. And if you don't remember that, you'll see the little button down here at the bottom that says Need Help. You can click on that, and it will resend your information to the email account that you set this up with. And if you've forgotten your password, you'll be able to reset that as well. It's a reminder now at Open Enrollment to make sure you update any personal information, whether you have a new dependent that you're adding, reviewing your Social Security numbers, dates of birth. Make sure that you update that beneficiary information online as well, and then you'll be making your election. To begin, you're going to get a welcome screen, and you'll see notice at the top left with your name. And then it's going to also show you how many days you have left to complete your enrollment. All enrollment does have to be completed by December 2nd. I'll remind you of that a few times just so that you don't forget. But you'll see a tab that says Benefits Enrollment, and you'll click on Annual Open Enrollment to begin your open enrollment for this year. And then on the following pages, you're going to proceed through all the prompts to make your benefit elections. You can verify any personal information, add your dependents if you need to add them onto the plan. You can also review detail about the plan. So kind of what we've talked about today has really been a high-level overview. You'll have the ability to click to get some additional details if you want some more information about how certain things are covered. And then if you have any tasks that are not complete, you'll see an orange box at the bottom. You'll see shown here that your enrollment is not complete yet. So it'll just remind you that you have a few more steps to do. And then you'll see for the voluntary life, there is an insurance election slider so that you can see what the cost is. It calculates it for you. It tries to make it as easy as possible. And if you are enrolling for the first time, if you're increasing coverage that's higher than $110,000 or for yourself or $25,000 for your spouse, just remember you do have to submit that medical evidence of insurability. If you don't complete that, then you won't have that additional coverage. So just a reminder that you do need to do that. And then at the very end, remember to go through and confirm your elections to make sure everything is correct before you submit them for processing. And I would encourage you to go ahead and print out that final sheet so that you can review and make sure the coverage that you've elected all matches up on that first paycheck in January when you get it, so that all of your coverage is correct. If you don't review that and don't have the correct people enrolled, and you review your information maybe in March or April and notice that something's not right, you have missed the window to correct anything. So you have 30 days from January 1 to get anything corrected if it doesn't look correct with what you've enrolled in through this open enrollment process. So just keep that in mind. And then if you did submit an evidence of insurability form for additional coverage, you'll be notified by mail on the final status of your life insurance election. So a few quick reminders for action items and deadlines. All employees have to complete that enrollment process online. Even if you're not making any changes, you have to go through, it's an active enrollment, and just review all that information to confirm that that's how you want to be covered for the upcoming year. You do have to still complete it if you're going to waive coverage. You still have to go through and complete that process online. And it is available now, and again, has to be completed by December 2nd. And that's to ensure that everyone gets their ID cards for the medical benefits prior to January 1. So just keep that in mind so that you do get those ID cards. Everyone will get a new ID card. It will come in a nondescript envelope if you've elected the coverage. So make sure you check your junk mail starting those last 2 weeks of December to look out for that ID card. You'll see a note here about our advanced resolution team. This is actually offered through your One Digital team. We do not work for the insurance carriers. We actually work on your behalf as an employee at Kaleo, and we have a team of folks here in our Richmond office actually that will work on your behalf for any claim issues that you might encounter over the course of the year. So if you've had a service and maybe that explanation of benefits and the bill that you received from the doctor's office doesn't quite match up, or maybe you've had a hospital stay and you've got a stack of bills a mile high and you're not sure how to review them or what you might owe or pay, you can reach out to our advanced resolution team. It's just an advanced customer service team. You'll see the email listed here as well as our phone number. We are different than Cigna in that we're not open 24/7, but you do have access to them from 8 a.m. to 5 p.m. Monday through Friday. It's a great group of folks that work in that department for us that really want to work on your behalf to solve any issues that you might encounter, and they do a great job for you all, at least as another set of eyes to make sure that your benefits are processed correctly. So now I'm going to go back through and see if we have any more questions. And if you've kind of held any questions, feel free to throw those in to the question box. I'm going to review those. We have a medical plan question. If you have one child that's in the hospital several times throughout the year, is the maximum out-of-pocket still $6,850 regardless of the number of hospital visits? And the answer to that is yes. One person is never going to pay more than the maximum out-of-pocket. It is $6,850, so that's correct. So you do have that individual protection if you have one person that's covered under the plan that may utilize services more than others. Another question is, to confirm, if we have Unum today, it will be canceled and switched over to the new life insurance. That is correct. So the Unum policies will end on December 31st at 11:59 p.m. and your new plan with Cigna will start at midnight, 12 o'clock on January 1st. And if you already enrolled and have a higher life insurance amount than the guarantee issue, you would still not need to fill out any new forms for that. So good question there. And it looks like that's all. I'm going to go ahead and click on the stop recording.